Okay, good afternoon, everyone, and welcome to another social emotional workshop. Today we are with CARE of Southeastern Michigan, and we are going to be talking about the effects that marijuana has on your body, on your health. And Kayla, we're so glad to have you back.
Thank you for having me back. I am going to put into the chat right now the link for the evaluation. This PowerPoint does not have the QR code embedded, so I just put that in the chat and I'll do it at the end of the presentation as well.
Okay, good deal. So everybody click on that link so that you can fill out the survey.
Okay. And I am going to turn my video off just so then that way it doesn't mess with the Wi-Fi while I'm presenting. Okay, so today we're going to talk about myths and facts regarding marijuana. So my name is Kayla Dadswell, and I am the Director of Substance Use Prevention at Care of Southeastern Michigan. So as we talked about before, Care of Southeastern Michigan has been around since 1977. In 2019, we opened our Recovery United Community Center. CARE's mission is to strengthen resiliency in people and their communities through prevention, education, and services that improve the quality of life. What that means is that we work with individuals and communities to ensure that they are healthy, safe, and have the resources and skills to live with resilience. So we do that through a variety of our different programs, which include youth and adult clinical and treatment services, case management services for families, recovery support for adults, for family, as well as teens. And then what I do is in the substance use prevention side of things, going into schools, providing presentations and programming to prevent substance use from occurring, as well as then parenting classes. So our objectives for today is that we'll identify health risks when using marijuana, dispel myths about using marijuana, and also identify consequences with using marijuana. So as we have discussed in previous weeks, so by definition, a drug is any chemical substance except for food that causes mental, emotional, or behavioral changes in the user. And what that means is that it's anything you put into your body except for food that changes the way you think, feel, or act.
Kayla, has your PowerPoint started? Because we're not seeing anything on the screen.
Oh, it did start. Let me see what's going on here. Can you see it now?
Yes, thank
Okay.
you.
All right. So as we know, so why do people use? So oftentimes it's to feel good. So they want a positive reward. It might be to relax. It might be something that they find fun. They might be curious about it. They might be using to fit in. They might have peers or even family members that are using. So then they want to use in order to fit in with those individuals. It might make them feel better, which also then leads to self-medication or because of addiction. So what we're going to do is we're going to do a fact or myth setup again this week. So when we get to the questions, if you can put in the chat fact or myth. So fact or myth, marijuana is a mixture of the dried and shredded leaves, stems, seeds, and flowers of the cannabis sativa or indica plant. So that is a fact. So marijuana is a mind-altering psychoactive drug that's produced by the cannabis sativa or cannabis indica plant. It contains 480 active ingredients, and the main ingredient that produces the psychoactive effect is called THC, also known as delta 9 um, faricannabinol. And what's interesting with this is that when marijuana is used, this is what causes the effects almost immediately. What we know is that THC rapidly passes from the lungs into the bloodstream, which carries the chemicals to organs throughout the body, including the brain. And the effects of smoked marijuana can last anywhere from 1 to 3 hours, depending on how much an individual consumed. So, fact or myth, marijuana is not dangerous. So, that is a myth. So, marijuana is dangerous. While we know that it's natural, that does not equal safe. So, for example, not all plants are safe to ingest. So, things such as tobacco or oleander, or even heroin, cocaine, and cyanide, these are all harmful substances that are made from plants. So, fact or myth, 24 hours after marijuana is used, it has no effect on the user. So, this is a myth. So, what we know is that marijuana could actually last 24 hours after use, and that really depends on an individual's biology. So, specifically their gender, weight, as well as a family history of addiction. It also depends on the strength or potency of the marijuana that's consumed, as well as any previous experiences. So, what we know is that the effects are going to be different for an individual who has previously used, as well as how it's ingested. So, compared to being smoked or consumed through an edible, it's going to have a different impact on how long it lasts for that individual, as well as if an individual used other substances while consuming it, or if the marijuana was laced with another substance, would have an impact on that 24 hours after use. So, fact or myth, marijuana changes how you feel, but not how you think. So that is a myth. So what we know is that THC is released very slowly into the body over time, and it actually overactivates the nervous system that causes the high and other effects that users then experience. So what we see is that with the effects of marijuana, there are some desired effects. So when speaking with individuals as to why they consumed marijuana, they reported that they consumed because they wanted to relax. They may have wanted an increased appetite. They wanted to have an altered perception. They also wanted to reduce anxiety and stress, or to feel happy. However, what they found is that there were some not so desired effects, one of which was loss of control, which didn't help with relaxation or anxiety or stress, lack of pain response, increased agitation. So, again, if someone's using that to reduce their anxiety or stress, they're then becoming more agitated. They then can't even relax or even reduce that anxiety and stress. Paranoia and confusion, seizures, vomiting, sweating uncontrollably, as well as elevated blood pressure, heart rate, and palpitations. So fact or myth, marijuana is not addictive. So that is a myth. So what we know is that addiction in marijuana is real. So addiction is having difficulty controlling one's drug use and not being able to stop, even though it interferes with many aspects of their lives. What we've seen is that earlier use actually increases the risk of drug abuse and addiction, and long-term marijuana use can lead to addiction. What we see is that if individuals before the age of 16 start consuming marijuana, they're actually 6 times more likely to face an addiction compared to peers who waited to consume a substance. We also know with addiction, there is withdrawal. So symptoms for withdrawal from marijuana include moodiness, sleeplessness, decreased appetite, anxiety, craving. So fact or myth, marijuana has a higher concentration of THC than it did a generation ago. So that is a fact. So what we've seen is that there's been an increase throughout the year. So it actually we started looking at potency of marijuana in 95 through 2021. And what we've seen is that THC has increased. There have been some occasional drops from previous years, but ultimately it's reached the highest potency since 95. And oftentimes we get asked, how long does THC stay in our system? So this is actually a very interesting thing within itself, because what we see is that it varies among the individual. So typically what we see with urine samples is that one-time use could still be detected within 5 to 8 days. However, again, depending on an individual's biology, these numbers can actually change. So 2 to 4 times per month could last and still be detected 11 to 18 days. 2 to 4 times per week, anywhere from 23 to 35 days since use. 5 to 6 times per week, 33 to 48 days, and daily use 49 to 63 days. And again, this is with urine, not if someone had, for example, to have a hair test. What we know is that substances actually last longer in the hair compared to urine. So that's something to keep in mind, as well as nail testing as well. So fact or myth, marijuana decreases your risk of having cancer. So this is a myth. So with marijuana, what we know is that most individuals are consuming it through smoking it. And so marijuana smoke contains irritants and carcinogens, and it's up to 70% more than that of tobacco smoke. So what we see is that use can actually create respiratory problems, which include cough, phlegm, acute chest illness, and as well as greater risk of infection. So what we see is that marijuana smoke irritates the lungs, and frequent smokers can have these respiratory problems. One study actually found that people who smoke marijuana frequently but do not smoke tobacco have more health problems and miss more days of work than non-smokers, mainly because of their respiratory illness. Marijuana also does have the potential to promote cancer of the lungs and other parts of the respiratory tract because it contains irritants and carcinogens. It also induces high levels of an enzyme that converts certain hydrocarbons into their cancer-causing form, which could accelerate the changes that ultimately produce those cancer-type cells. And since marijuana smokers generally inhale more deeply and hold their breath longer than tobacco smokers, the lungs are actually exposed longer to the carcinogen smoke. However, while several lines of evidence have suggested that marijuana use may lead to lung cancer, the supporting evidence is actually inconclusive. And so, fact or myth, the risk of a heart attack is almost 5 times greater in the first hour after smoking pot. So, this is actually a fact. So what we know is that the normal heart rate is anywhere from 70 to 80 beats per minute. However, marijuana use can actually increase an individual's heart rate up to 160 beats per minute. And this can ultimately result in a heart attack in an otherwise healthy person. Taking other drugs with marijuana can also increase this effect. And what we just need to make note of is that heart attack risk may be related to increased heart rate, as well as the effects of marijuana on the heart rhythms, causing those palpitations. This risk may be greater in individuals that are older or in those with cardiac vulnerabilities. So, fact or myth, marijuana impairs your judgment and ability to make decisions. So, this is a fact. So what we know is that the teenage brain is still being developed, in that there's the prefrontal cortex, which I like to call the brake center, because this ultimately controls impulses. However, this part of the brain is usually the last part to be developed, and it's not usually developed until mid 20s, typically anywhere from 25 through 27. However, some research is showing that it's not fully developed in some individuals until their 30s. So what I'm just going to ask is that everyone um, just do a very quick, um, uh, simple hand movement in which you'll touch your middle finger to your thumb quickly and repeatedly. So for individuals that are non-users and they're doing this hand movement, they're activating this small region of their brain. However, individuals who are using and doing that simple hand movement, they're actually activating and stimulating multiple different parts of their brain, which causes that individual to work harder. So if we were to think of simple tasks that we do every day, such as maybe studying, taking a test, or maybe some more in-depth things such as driving a car, talking, things of that nature, we're going to struggle a lot more to use our parts of our brain compared to if we were not using. So fact or myth, marijuana can trigger mental illness in people who are prone to it. So that is a fact. So what we see is that long-term marijuana use has been linked to mental illness in some people, such as temporary hallucinations, as well as temporary paranoia, as well as that it actually worsens symptoms in patients with schizophrenia, um, because schizophrenia does include symptoms such as hallucina- hallucinations, paranoia, and disorganized thinking, which if it's already increasing that for individuals without it, it's going to then increase it for individuals that do have it. We also know that marijuana use can make depression, anxiety, and other mental health problems worse and has been linked to even suicidal thoughts. What we see in teens is that weekly use of marijuana actually doubles a teen's risk of depression and anxiety. And marijuana use can actually take away the drive to engage in activities and succeed in school. This is something that we call amotivational syndrome. An amotivational syndrome is characterized by a diminished or lost drive to engage in formally rewarding activities. Whether this syndrome is a disorder unto itself or is a subtype of depression associated with marijuana use actually remains controversial, and whether marijuana causes it or it's a response to it is still not understood. So, fact or myth, I can be around someone smoking marijuana and have no effects. So, this is a myth. So, similar health risks are actually linked to tobacco smoke as well as marijuana smoke. And it's unlikely that a person will fail a drug test or get high from passive exposure by inhaling secondhand marijuana smoke. However, if people are in an enclosed room, breaking in loss of breathing in smoke for hours at close range, studies have shown that people who don't use marijuana report only mild effects of the drug from a nearby smoker under extreme conditions. So, fact or myth, smoking marijuana impairs your academic skills. So, this is a fact. So, what we see with marijuana in school performance is that it negatively affects learning. So, a teen who uses is 4 times more likely to report D grades, and it's also linked to a higher dropout rate. So, a teenage marijuana user is 2 times more likely to drop out of school than a non user. Also, what we know is that marijuana negatively affects attention, memory, and learning, and this can last for days and sometimes weeks, especially if used often. So sometimes individuals who smoke daily can have what we call a dimmed down brain, most or all of the time. And what that means is that, so if we were to think of, for example, of a brain as a light bulb, that the light bulb's a lot dimmer than what it normally is, so it's not as bright. And if smoked regularly during the teen years, it can actually lower IQ points by up to 8 points. And what's important to point out here is that someone who smokes marijuana daily may be functioning at a reduced intellectual level most or all of the time. So, fact or myth, marijuana is the second most common illegal drug involved in fatal car accidents. So this is a fact. So what we see is that the risk of being involved in a car crash actually doubles after using marijuana. And that's because the reaction time needed to drive safely decreases even more when someone uses marijuana, especially with alcohol or other drugs. So what we know is that marijuana negatively affects the following skills needed to drive, which include coordination, so the steering, braking, and accelerating, reaction time, so sufficient time to respond to an act, tracking, so the ability to stay in a lane and maintain a safe distance, attention, so ability to focus and process information, as well as judgment, so thinking, avoidance of potential hazards, and the ability to maintain control. So, fact or myth, longtime marijuana users have reported that they are less satisfied with their lives. So, this is a fact. So, in a recent survey, they actually asked individuals who had reported using marijuana longer than 10 years, and they indicated that they were less satisfied with their lives. And that's due to having more memory and relationship problems, which, um, as we know, is that not remembering certain things in a relationship can definitely cause some problems, as well as they report poorer mental and physical health, lower salaries, less less career success. So, fact or myth, marijuana use can close the door to your future.
Taylor, can I ask a question regarding marijuana affecting the memory?
Yeah, absolutely.
So, of course, while using marijuana, it affects and impairs. But what if you quit using marijuana? Is there damage done that could affect your ability to remember things and be?
Yeah. So, what we've seen is that, especially during when the brain is still being developed, because what we see is that most times is that individuals aren't waiting until 25 or 30 to try marijuana. So, when the brain is still being developed, it actually damages the different parts of the brain. So, remembering things even long-term memory is impacted, but then also short-term memory as well.
Okay, thank you.
Yeah. So this is a fact. So what we know is that there are legal consequences to possession of marijuana, and that includes 1 year in jail and or $2,000 fine, plus the court costs, as well as 6 months suspension of driving privileges. And that it with this, what's interesting is that you don't even necessarily have to be driving for this suspension of driving privileges to occur. Marijuana use conviction includes 90 days in jail and or $100 fine plus court costs, as well as 90-day suspension of driving privileges. What we know is that many companies, industries, and professions do require drug testing to be hired and or being drug tested when employed. So while marijuana is currently legal for recreational use for an individual 21 and over, depending on that company's policy, as well as, let's say, for example, at a federal level, because it's not legalized federally, what we've seen is that a lot of federal jobs or even jobs working with the county or with the state have not been able to hire individuals because of them testing positive for marijuana. We also know that job applications often ask if someone has been convicted of a crime or has a case pending, including drug-related offenses. With college admissions, marijuana convictions must be reported on those college applications, which can then potentially cause an individual to get denied from entering into college. And then when it comes to financial aid, what we see is that 1 in 400 students, so over 40,000 nationwide, have been denied federal financial aid due to a drug conviction. And scholarships have also been denied or discontinued because of a drug conviction. So according to the Government Accountability Office, an extension of the U.S. Congress, Pell Grants are denied to about 20,000 students annually because of drug conditions. And then federal financial aid to students, keep in mind, come in many forms, including Pell Grants, Stafford loans, PLUS loans, Perkin loans, and work study programs. So students convicted of felony drug possession crimes and all offenses involving drug sale or distribution are required to immediately notify their financial aid administrator and are then required to pay back all aid received after the date of conviction. So fact or myth, marijuana has not been approved by the FDA for any known medical condition. In order to get FDA approval, the benefits of the drug have to be greater than the risks of taking the drug. So that is a fact. So marijuana is not approved by the FDA, and there are no, at this time, no medical conditions that have been proven that marijuana can cure or help with symptoms. So the thing to remember is that someone who uses drugs, including marijuana, risks hurting themselves physically and emotionally. And marijuana use can have a significant effect on health, family relationship, friendships, and the ability to perform well in school and sports. It's important to find ways to manage feelings and deal with stress and have fun without using marijuana, alcohol, and other drugs. And most importantly, most teens do not actually use marijuana or other drugs. And so if someone ever needed help, they can always contact Cure of Southeastern Michigan at 586-541-2273 or our Recovery United Community Center at 552-1120. And then does anyone have any questions at all?
You guys, you can unmute and ask your questions, or if you prefer, you can type them in the chat. I'll be more than happy to read them.
And then I also included in the chat again the evaluation. If you could take a couple minutes and just fill out that evaluation, I would greatly appreciate it.
All right, then, if there aren't any questions, we will bring the session to a close. Again, make sure you click on the link to fill out the survey. Thank you, Kayla. Excellent presentation. And thank you guys for joining. And we'll see you all next time.